Thanks, everyone. Thanks for joining us today on another beautiful day in our region. And I want to thanks to University of Washington Medical Center for hosting. We are here today to raise the alarm about a new program that has been denying Washington seniors necessary medical care and making it harder for providers to do their jobs. In a moment, you're going to hear from patients, medical providers, and healthcare leaders who've all had the experience of dealing with this program. But first, let me set the stage a bit. This January, the Trump administration launched its Wasteful and Inappropriate Service Reduction, or WISER program. This is an experiment that contracts with private technology companies in 6 states, 6 pilot states, including Washington, that allows them to use artificial intelligence to review, delay, and deny care to patients who are under traditional Medicare. These companies are paid a percentage of the cost of care that they deny, which creates a clear perverse incentive. Just before I came here today, I was informed from CMS, the Centers for Medicare and Medicaid Services, that they are requiring Vertex, which is the company that's handling the claims in Washington, to submit a corrective action plan for noncompliance with the program's review timeline. Companies like Vertex are supposed to complete their review within 72 hours, and CMS told me in May that these benchmarks were being met. But from the news that I just received, CMS was aware in February that Vertex was not meeting this 3-day review. This confirms what we've already known from providers and patients who we've talked to throughout our region. Care is being delayed much longer than 72 hours. And while I'm encouraged that Vertex is being held accountable, this underscores my fundamental concerns that this program is unnecessarily delaying and denying care to seniors. That's what happens when you roll out a program without proper vetting, without transparency, and without safeguards. Washington seniors should not be the guinea pigs for the administration's AI experiment. This program is nothing more than a Trojan horse to privatize Medicare. I've been demanding answers and spearheading several legislative efforts to cancel the WISER program. Recently, I questioned Health and Human Services Secretary Kennedy about the program when he appeared before the Ways and Means Committee in Washington, D.C. I also shared with him the story of Joanne, a Washington senior who's enrolled in Medicare. She had a herniated disc pinching her sciatic nerve. Her doctor prescribed an epidural steroid injection to help alleviate her immense pain. Before this year, getting that procedure done would have been quick and routine. But because of WISER, Joanne waited for over 6 weeks to get approval. She had to use crutches and fell multiple times, making her condition worse for no reason. Miraculously, Joanne's procedure was approved the day after I raised this issue with Secretary Kennedy. And it should not take a member of Congress getting involved to get routine health care approved. The administration says seniors have the option to appeal denials, but we know from what happened under Medicare Advantage that patients also had the same ability to appeal these decisions, and the data tells an alarming story. In 2024, only a small fraction, 11.5% of Medicare Advantage denials were appealed, and 80% of those appeals were overturned, meaning they never should have denied care in the first place. And appealing is not an easy thing. It's complicated and takes a lot of time. All of this is a sign of a deeply flawed system. Prior authorization shifts the burden onto patients and providers, while private companies collect money that should go to care. The administration has so far withheld data of denials and the appeals that they've seen under the WISER program. That's why today I'm calling on the Trump administration to release the data it has so far on this program. Congress and the public deserve a full understanding of the impact this program is having on our seniors and our healthcare system, especially given the news about Vertex's noncompliance. I'm joined by 29 of my colleagues in the House in this effort. We're going to get answers on how much care this program has been denying, and we're going to make sure that seniors get the care that they deserve. So now I want to turn it over to Gita Bunyo, CEO of the UW Medical Center, to discuss how this program impacts our local healthcare system.
Good afternoon, and thank you, Congresswoman DelBene, for bringing attention to this critically important issue affecting our patients, providers, and healthcare systems across Washington state. My name is Gita Bunyo, and I serve as the Chief Executive Officer for University of Washington Medical Center. At UW Medicine, our mission is to provide health of the public, to improve the health of the public. As one of the largest and most comprehensive academic medical systems in the Pacific Northwest, we employ more than 35,000 people. We provide approximately 1.8 million outpatient visits and nearly 60,000 inpatient admissions every year. We operate Harborview Medical Center and UW Medical Center, the institutions that play a vital role in caring for our region's most vulnerable patients, while also training the next generations of physicians and healthcare professionals. Because we serve a significant Medicare population, we are among the healthcare systems experiencing the direct effects of the CMS WISER model today. We support the efforts to ensure appropriate use of healthcare resources and to safeguard the integrity of the Medicare program. However, the WISER model as currently implemented is creating unnecessary barriers to timely patient care, increasing administrative costs, and diverting clinical resources away from our patients. Most concerning are the real world impacts for the patients who we serve. And the delays created by this program are not abstract. They affect patients waiting for medically necessary procedures and treatments that have already been recommended by their physicians. These are not simply case numbers. These are patients, many of them with very complex medical conditions and multiple chronic illnesses, whose care is being postponed despite the judgment of the clinicians responsible for their treatment. Even short delays can have serious impact. They can lead to worsening disease, avoidable complications, emergency department visits, hospitalizations. I can go on, not to mention the anxiety that patients and the families experience while they're going through these delays. These delays are not in care, but just creating additional obstacles for our patients. Hospitals are being required to devote substantial resources to navigating new layers of reviews, documentation, and appeals. Each hour spent managing these requirements is an hour that could be otherwise spent on patient care and really truly caring for the patients that we serve. Hospitals share CMS's goal of delivering high quality, appropriate care while protecting Medicare resources. But the current WISER model process is not achieving that balance, and instead it is creating avoidable delays for patients and significant burdens for providers across our state. Treating physicians are best positioned to determine the most appropriate care for their patients. To improve quality and reduce improper hospitalization should support clinical decision making, preserve timely access to care, and minimize unnecessary administrative complexity, not create barriers to medically necessary treatments. Today, you will hear directly from patients and providers who have experienced these challenges firsthand. These stories will show the very real impacts of the program and the need for meaningful changes. I want to thank you again, Congresswoman, for your leadership on this issue and for convening this very important discussion. It is now my privilege to introduce Keith Magnuson, the patient you will hear from today.
I've had back problems for a long time, and I was looking into very invasive surgery when I discovered what they call the MILD, which is minimally invasive lumbar decompression. I liked the idea of it, and I went for it and decided to have it done. I was going to do this last year, and we wouldn't have had this WISER block because it wasn't implemented yet. Unfortunately, I injured myself, and had a setback, so I didn't get to do this until this year. So I signed up for it this year, and then my doctor's people come back to me and say, well, we got a problem. There's this new deal called Wiser, a misnomer if there ever was one, and they were denying the epidural that my doctor prescribed as part of the procedure. The epidural was to relieve pain. I like that idea. So back and forth with denials from the Wiser program. Finally, I offered to pay the epidural. I'm lucky I have enough money, I can afford that. And at first, my doctor's people were skeptical of that, but after a few weeks of waiting, they came back to me and said, hey, how about if you pay for this? And I said, let's do it. So that's what happened. What I object to is private for-profit business meddling around in Medicare. They don't belong there. I don't like the idea even of somebody, a private for-profit business, getting between my doctor, myself, and Medicare. So basically, Wiser is incentivized to deny because that's how they get paid. So it's almost an automatic denial for a lot of this stuff, and that's just plain unfair. So I've had the procedure done, I'm doing pretty well. I'm still in a recovery process, but that epidural I am very happy for. So that's about all I have to say about it. I'd like to introduce Dr. Chris McMullen.
Good afternoon. Thank you to the Congresswoman for bringing attention to this important issue and for giving physicians and patients a voice in this conversation. Thank you to Keith for sharing his story. Unfortunately, it's a familiar one. I would also like to thank the American Academy of Physical Medicine and Rehabilitation and UW Medicine for helping connect clinicians on the front lines with policymakers. My name is Dr. Chris McMullen. I oversee 19 physicians in the Sports and Spine Division in the Department of Rehabilitation Medicine here at UW. Our division cares for patients with spine, musculoskeletal, and neurologic conditions across our region. Many of us perform epidural steroid injections as part of our practice. It's an evidence-based, low-risk procedure that can help reduce a patient's pain, improve function, guide surgical decision-making, and in some cases, help a patient avoid a surgery entirely. I want to acknowledge something important. We understand that healthcare resources are finite, and physicians support efforts to ensure procedures are used appropriately. We all want evidence-based, high-value care. The problem is not that shared goal. The problem has been the implementation. One of my colleagues recently cared for a patient whose epidural injection took nearly 5 months to obtain approval. The patient's case wasn't straightforward. Multiple specialists with decades of combined expertise and experience weighed in on what they felt was the right course of action for this patient. Wiser's automated review process disagreed. The thing is, patients don't always fit neatly into standardized algorithms. When broad rules are applied without sufficient room for clinical judgment, appropriate care can be delayed or denied outright. I've seen this in my practice as well. An elderly, long-time patient of mine suffers from issues related to arthritis in her spine and has frequent recurrent nerve pain. She receives an epidural injection maybe once yearly, and while not a cure-all, it's one of the few treatments that provides her with meaningful, lasting relief. Despite years of clear clinical benefit, because an exact percentage of pain relief from her injection done a year ago had not been documented, the injection was denied. Across our division, similar stories are playing out. We're seeing longer approval times, blanket denials, and growing administrative burdens on physicians and staff. Most importantly, we see patients left waiting in pain. We welcome accountability and evidence-based standards, but any system intended to improve healthcare values must also preserve physician judgment and recognize patients are individuals, not checkboxes. Thank you for this opportunity to share our experience. I'd now like to introduce Dr. Bindu Nayak, Vice President of the Washington State Medical Association.
Thank you, Dr. McClellan, and thank you for your leadership and for bringing attention to the WISER model and its impact on Medicare patients and physicians in Washington State. The Washington State Medical Association represents thousands of physicians and physician assistants caring for patients in every corner of our state. We support innovation, we support responsible use of artificial intelligence, and we support efforts to reduce waste and improve value in healthcare. What we do not support is creating new barriers that delay or disrupt medically necessary care for Medicare patients. The WISER model is deeply concerning because it introduces a new layer of prior authorization and pre-payment review into traditional Medicare. For decades, traditional Medicare has avoided these administrative barriers, helping to make sure that seniors and people with disabilities can get timely and medically necessary care. WISER moves Medicare in the wrong direction, toward the burdensome prior authorization programs commonly used by commercial insurers, which often delay care, increase administrative complexity, and take away valuable time away from patients. Physicians across Washington are already struggling under the weight of growing administrative burdens, which are a significant contributor to professional burnout. Every hour spent navigating prior authorization requirements, documenting for review, or responding to care requests is an hour not spent caring for patients. At a time when physician burnout remains a serious challenge and workforce shortages threaten access to care, we should be looking for ways to reduce unnecessary administrative work, not create new layers of it. CMS is testing a model that relies heavily on artificial intelligence and outside contractors to review physician decisions before payment is made. While AI can be a useful tool, it should support clinical decision-making, not create more obstacles between patients and their physicians. We are particularly concerned about three issues. First, patient access. Even short delays can have real consequences for patients waiting for procedures and other care, as we heard about today. Second, physician burden. Every new review requirement means more staff time, more documentation, more appeals, and often extra visits with the same patient just to satisfy administrative requirements. These activities take up valuable clinical and administrative resources, contribute to physician and staff burnout, and take away time and attention away from direct patient care. Third, transparency and accountability. If WISER is meant to improve Medicare, its performance should be measured and reported openly. Physicians, patients, and policymakers deserve clear data that allows them to evaluate whether the model is actually improving care, reducing burden, and achieving its intended objectives. Washington physicians are not opposed to innovation. In fact, many are leading the adoption of AI tools that improve quality, reduce burnout, and enhance patient care. But innovation should make healthcare simpler and more effective, not more challenging to provide necessary care. That's why WSMA appreciates Representative DelBene's engagement on this issue and supports efforts to ensure Medicare patients keep timely access to medically necessary care without unnecessary administrative barriers. Our message is simple. Medicare should work for patients and physicians who care for them. Innovation should strengthen, not complicate, the patient-physician relationship. Most importantly, it should help patients receive the right care at the right time. Thank you. And I'll hand it back over to Congresswoman DelBene.
I want to thank everyone and also just again highlight that this is about making sure that our seniors are receiving the care that they deserve in a timely, efficient way, that our healthcare providers aren't being unduly burdened by spending more time doing paperwork than actually being able to provide healthcare. And we deserve transparency from the administration on exactly what's happening with these programs. I want to thank everyone for being here, and we'll open up for any questions you might have.